Hepatitis B is a viral infection that attacks the liver and can cause both acute and chronic diseases. It is caused by the hepatitis B virus, or HBV, which is a member of the Hepatnaviridae family. It is important to understand the transmission, symptoms, diagnosis, treatment, and prevention of this disease to effectively manage it. Hepatitis B is primarily transmitted through contact with infectious body fluids, including blood, semen, and vaginal secretions. This means that the virus can be spread through activities such as unprotected sexual intercourse, sharing needles during drug use, and from mother to child during childbirth. In some cases, it can also be spread through sharing personal items like razors or toothbrushes with an infected person. Once the virus enters the body, it can cause a range of symptoms. Some individuals may experience an acute phase, where symptoms can appear within 1 to 6 months after exposure. These symptoms can include fatigue, weakness, loss of appetite, nausea, vomiting, abdominal pain, dark urine, pale stools, joint pain, and jaundice, which is the yellowing of the skin and eyes. However, many people, especially children, may not show symptoms at all and can unknowingly spread the virus to others. While some individuals can clear the virus from their system within 6 months, others may develop chronic hepatitis B. Chronic hepatitis B is defined as lasting longer than 6 months and can lead to serious complications like liver cirrhosis, liver failure, and even liver cancer over time. Approximately 5 to 10% of adults who contract hepatitis B will develop chronic infection, while up to 90% of infants infected at birth will go on to be chronically infected. Diagnosis of hepatitis B involves blood tests that detect the presence of the hepatitis B virus and determine whether you have an acute or chronic infection. The most common tests measure the levels of hepatitis B surface antigen, or HBsAg, which indicates an active infection, along with antibodies produced in response to the virus. Additional tests may also be conducted to assess liver damage and the risk of complications. When it comes to treatment, not everyone with hepatitis B requires medication. For those who have an acute infection, healthcare providers may recommend regular monitoring, as the body is often capable of clearing the virus on its own. For chronic hepatitis B, antiviral medications are available. These medications can help reduce the viral load, lower the risk of liver complications, and improve liver function. Regular medical checkups are essential for anyone diagnosed with chronic hepatitis B to monitor liver health. Preventing hepatitis B is critical. The most effective way to prevent infection is through vaccination. The hepatitis B vaccine is safe and effective and is typically given in 3 doses over a 6-month period. This vaccine is recommended for all infants, children, and adults at risk. It's particularly essential for healthcare workers and those with multiple sexual partners or individuals who share needles. Aside from vaccination, practicing safe sex, using barrier methods, avoiding sharing needles, and ensuring that blood products are screened can significantly reduce the risk of transmission. In summary, hepatitis B is a serious viral infection that affects the liver and can lead to significant health issues. Understanding how it is transmitted, recognizing the symptoms, and knowing your options for diagnosis and treatment are paramount for managing this infection. Vaccination is the most effective preventive measure, along with practicing safe behaviors. If you or someone you know is at risk, consider getting tested and discussing vaccination options with your healthcare provider. Early detection and proactive management can lead to better health outcomes and help reduce the spread of hepatitis B in communities. Thank you for watching, and stay informed about your health.